Today I am going to talk about my research, which is the effect of botulinum neurotoxin type A on induced prostatic hyperplasia in male rats, written by MSc student Ghazi Faisal under the supervision of Ustad Dr. Mustafa Abbasi, Assistant Prof. Dr. Isra Burhan. So we are going to define prostatic hyperplasia. Prostatic hyperplasia is a stromal and glandular epithelial cell hyperplasia in the zone of the prostate which is surround the urethra. It is associated with symptoms such as acute urinary retention, urinary incontinence, renal failure, and frequent urinary tract infection. Now we have several pharmacotherapies that play important role to treat bladder obstruction and significant decrease in both storage and lower urinary tract symptoms within hours or days. Now we have a standard therapy, which is 5-alpha reductase inhibitor, steroids, and alpha-1 adrenergic receptor blocker, which is tamsulosin. This combination is thought to treat benign prostatic hyperplasia symptoms and reduce prostate size. Now we begin with steroid, which is 17 beta substituted for as a steroid, which is a competitive inhibitor of type 1 and type 2 5-alpha reductase isoenzyme, and form a complex with a slow rate of dissociation, but not bind to androgen receptor. Dihydrotestosterone, the product of the conversion of testosterone by the enzyme 5-alpha reductase, and 5-alpha reductase inhibitor lead to decreased production of dihydrotestosterone in the prostate, and thus decrease prostate volume, increased peak urinary flow rate, and improve symptoms score. Studies have also shown that 5-alpha reductase inhibitor reduce PSA and risk of prostate cancer. Now we are going to talk about the tamsulosin, the second agent, which is most selective alpha-1 adrenergic blocker approved for use in the treatment of symptomatic prostatic hyperplasia. It was significantly reduced by the combination with steroid. We are talking about the autonomic action on the prostate. Recent evidence have demonstrated the complementary role of the two branches of the autonomic nervous system in prostate cancer initiation and progression. Firstly, the sympathetic nervous systems play an important role in the early stages of tumorigenesis through beta-2 and beta-3 adrenergic receptors. And secondly, the parasympathetic nervous system plays predominant role in cancer metastasis through muscarinic acetylcholine receptor. Now we're talking about the muscarinic response in the prostate. The functional role of muscarinic receptor and the subtype in the human prostate has been assessed at multiple levels, which include firstly the calcium level. The investigator reported calcium elevation in response to carbachol and several other muscarinic agonists. Such response at least partly inhibited by muscarinic antagonists. Secondly, we have the cyclic adenosine monophosphate level. Muscarinic receptor agonists such as carbachol and oxytrimorine found to inhibit cyclic AMP formation in response to forskolin and isoprenaline in the prostatic stromal cells. So this result, which is in line with the proposed the presence of the mTOR receptor in stromal cell because cyclic AMP is known to inhibit prostatic contractility. We also know choline is activator of the adenylyl cyclase, which increase the concentration of cyclic adenosine monophosphate. Thirdly, we have the response at the tissue level, which include regulation of prostate secretion and contraction and modulation of release of other neurotransmitters. Muscarinic role in the prostate growth. Based on the predominant muscarinic receptor expression in the prostatic epithelium, it could be expected that muscarinic receptor will contribute to the regulation of prostatic growth. Primary cultures from patients with either enlarged prostate or prostate cancer exhibited growth stimulation on a treatment with muscarinic receptor agonist carbachol. Now we are going to talk about the most important point in this presentation, which is the investigated therapy, which is botulinum neurotoxin type A. Botulinum neurotoxin A is a novel treatment for benign prostatic hyperplasia. Intraprostatic injection reduce prostate volume and decrease urine volume and serum prostate-specific antigen level. The botulinum neurotoxin type A is a double-chain light and heavy chain. The heavy chain protein is connected by the disulfide bond in the presynaptic nerve membrane, and the C-terminal of the heavy chain bind to the synaptic vesicle protein 2 and synaptogenic. The toxin is taken into the nerve terminal by endocytosis. Now we are talking about the light chain. The light chain is the important chain of the botulinum neurotoxin because it is the functional chain. The light chain inhibits the acetylcholine release by enzymatic degradation of the soluble and acetylmelamine sensitive fission attachment protein, which is called SNAP25. So the nerve failed to form the synaptic fission complex, which is the snare complex. This impairs exocytosis of acetylcholine. The effective neurotransmitter include acetylcholine, noradrenaline, adenosine triphosphate, and others. Presynaptic adrenergic neuron also use acetylcholine as a neurotransmitter. So botulinum toxin type A intraprostatic injection may have anti-adrenergic action because the adrenergic ganglia are located near the prostate gland. In this figure, we see numerous types of botulinum toxin with a different mechanism of action. And we see the botulinum toxin type A cause enzymatic degradation of the SNAP25 protein and the vesicle enabled to form the snare complex, and thus the exocytosis of the acetylcholine is blocked. Now we talk about the method of induction of benign prostatic hyperplasia in male rats. We will use the testosterone propionate. Testosterone propionate causes benign prostatic hyperplasia through inflammation, regulation of anti-apoptotic gene, and proliferation. Inflammation is commonly presented in prostatic hyperplasia, which cause tissue injury and cytokine secretion from inflammatory cells and may drive angiogenesis and local growth factors. Interleukin-8 and tumor necrosis factor are pro-inflammatory cytokines and considered as a potent growth factor for prostatic epithelial and stromal cells that increased in benign prostatic hyperplasia. So we will use these two indicate these two cytokines as a parameter in this research. The aim of the study is to investigate the effect of botulinum neurotoxin type A compared with the dutasteride and tamsulosin combination in the treatment of prostatic hyperplasia that induced by testosterone in male rats. We are going to talk about the methodology of the research. Adult male Western rats weighing 300 to 350 grams were maintained in an animal house at 22 centigrade under dark light cycle of 12 hours. We will take 48 male Western rats will be allocated into three groups. The first group is the negative group, which is 12 rats injected with 0.5 ml per kilogram normal saline intraprostatic for 8 weeks. The second group, which is 36 rats, induced benign prostatic hyperplasia by subcutaneously injected olive oil will mixed with the testosterone propionate at a dose of 25 mg per kilogram per day for 4 weeks. 12 rats of which will continue administered of 0.5 ml per kilogram normal saline intraperitoneal for 4 weeks after induction. Third group include two types of treatment. 12 rats will administer combination of 0.01 mg per kilogram tamsulosin and 1 mg per kilogram dutasteride, one daily by oral gavage for 4 weeks. And the second group is the 12 rats administered with the botulinum toxin 5 units once daily by slowly injected in several points of the ventral lobes of the prostate using a 30 gauge needle, which were harvested and weighed after 4 weeks. We will talk about the research parameter for measurement. Firstly, the biochemical markers include prostate-specific antigen dihydrotestosterone, interleukin-8, and the tumor necrosis factor alpha. And secondly, the histopathological examination of the prostate gland. The prostate harvested from the surrounding tissue and fat will be carefully removed. The entire prostate emerging fixed in 4% of paraformaldehyde and cut in 20 micrometer transverse sections using a micron cryostat. Here we have the references. And lastly, thank you for listening.